spike of mental illness in the world. Charity Mwangi, NTV.
And definitely a story that resonates with so many of the people in this country and the world over as we all collectively face the pandemic. Well, the conversation today is taking stock of our mental health. It's been a tough year, and this morning we not only find out how you're doing, but we also understand better about mental illness and how best to actually manage it, and how those who are living with, mental illness or have had lived experience have faced the year. And to help us with this conversation this morning in studio, I'm joined by Margaret Mbuthi, who is a psychologist. In the other studio, I'm joined by Tugi Wayaki, who is a mental health advocate and has lived experience with clinical depression. Also, Charity Muturi, who is a member of the mental health task force put together by the government last year and also has lived experience with bipolar. And joining us in our studio on the 5th floor of this building is Calvi Ondek, who is the founder of Let's Talk Men's Mental Health. If I got that right, Let's Talk Men's Mental Health. Thank you all for joining us on this conversation. And I'll start off with you, Margaret. I know you're a professional, but let's talk to the human being first. How are you doing?
Good morning, Gladys.
Good morning.
Thanks for having me. How am I doing? This morning, struggling. Just like most of the Kenyans. We lost a close family member last week, buried on Friday. So, yes, also going through the motions, just trying to figure out how do I support those around the family. People look up to you as a clinical psychologist and think that you're strong, you have it all, and people need your support. But then there's also that bit of you that also needs support from someone else. So yeah, struggling. COVID period has been hard in many ways. Being out of work, because we are not teaching. I work at the technical university, so also just trying to find out how my students are doing and getting calls. They've lost their loved ones have lost jobs, and just that disconnect. And it's been common around this period to wake up to a text message from a student that I'm depressed, I am suicidal, and hardly does a day go before I get those SOS kind of calls from even different networks and different forums. Yeah, COVID has been a very hard period. So even as a practitioner, sometimes we get overwhelmed. There are requests for financial support, yet that's what everyone is dealing with. Lots of violence at the family front, and so people are reaching out. It's been one season that is heavy even for the practitioners, and it's sad when COVID hits home. It can be a very trying period. And also as a family, we've also lost since March, I think about 5 in the larger family. So it's also been, you oscillate between very low, you're functioning, and then people expect you to have it all together, and that you're the one who is going to be to offer the support. But even us as practitioners, as mental health practitioners, we also go through our emotions.
And speaking of which, how do you cope?
Mostly through supervision. I have my seniors in the profession that I call when I feel overwhelmed. Yes, so there are those that I reach out to, there are those that I share what I am dealing with. And then, of course, I have very good professors who also reach out to me, and they're like, Margaret, how are you doing? So I also get to talk it out. And then I have friends as well who also get me out of the situation, over coffee or something. And my children are my greatest support system as well.
Okay,
Yeah,
excellent. And it's good to actually hear that practitioners are human beings first and they are facing the same challenges we all are. It's just that they have an added advantage. They know how to cope and cope with everything a bit more better than the next person. So we'll get back to your story in a moment. Let's hear from Kelvin. It's been a difficult year all round, and it has been highlighted that with the loss of social economic status for most people, loss of jobs, loss of businesses, the men have really been hit hard because in most homes they are the providers. Where are you this morning? How are you this morning?
I'll say I'm at a very interesting place because so many things have where you expected to provide and things are not as easy as you would want them to be. So I'd say you find the joy in the small things that are happening in your life. Like family, when you have family, those are some of the things you look forward to. Having people to just talk to you and say, you know what, it's gonna be okay. This is not the end. That you have something to look forward to. Yeah. So yes, as a man speaking, it's not been easy, but the fact that we have people looking out for us, who hold us accountable and who also show us love, that's a very important thing, and it helps us grow and even feel like we have a support system around us. And I think that's the best thing ever for this season, that people show you love and care and ask you the simple question of, are you okay? How are you doing? How are things? You know, because those are some of the things that people forget to ask. People forget to have conversations like that.
Okay, now you talk about people asking you how you are, but we know that most men struggle with opening up about their struggles. Is this something that you face?
Yes, very true. We struggle, but you see, when we make it a culture, things change. The problem is that it's not been a culture for the longest time, and we work on the things that have been happening in the past, the traditions and all those things. So when you don't, we're not used to such words for how are you doing. We are always supposed to be on the going. We're always supposed to be moving. So when someone asks me how are you doing, I'm like, what do you want? Okay, but when we make it a culture, then it's easy to help each other. It's easy to work together and to understand that by there I'm also human and I can express myself.
Okay, and even as we talk about having lived experience, you've had lived experience with mental illness, something that was spiked by a similar situation like we are in today. Talk about that.
It started in different stages. I didn't know I was facing depression until it hit so hard, and when I can't say it was too late, but a number of things were happening in my life where work, an incident happened at work, I lost a friend, and so all these things built up to something. But I was in this space or this box that I didn't know what was going on at that time, until someone, I had it from someone, and I was like, okay, probably because I could say one of the things that used to happen, I would stay in the house by myself, lock myself. I didn't want to eat at all, and through that, someone was like, "Yo, are you okay? Are you doing fine?" And so a number of my friends rallied themselves around me and made sure that this guy, we have to help him out. We have to do something because the way he's going, and you know, they rallied, but I had to accept that by there I am not okay. Because if I didn't accept, then there's nothing they would have done. They would have just kept quiet and said, okay, we'll be there. But I had to accept and say, guys, I am not okay. Because I remember the last thing, the thing I did was I sent each one of a text and told them, guys, this is what is happening. I am at this space where I'm about to commit suicide and I need help. And all of them, surprisingly, all of them showed up and they're like, yo, you're not alone. Let's see how we can walk through this together.
Very encouraging, and we'll hear more about your journey. And Margaret, I'm sure listening to Kelvin, you resonate with so many men that struggle with mental illness. First of all, because they do not even recognize it, but also do not speak of it. Tell us more.
It's good to hear from Kevin. It's good when we have not because he's a man, but when we have people with lived experiences talking about it, and because they instill hope that you can be there, but you can get up when you seek help, and that you can look back and say, that's where I was, and this is where I am now. And that resonates with very, very many men in this country and maybe the world over. And one of the things, Gladys, is that our men have been socialized and cultured that you must man up. When you seek help, when you see you're depressed, when you see you're struggling, you're not man enough. And for that reason, they tend to suppress what they are dealing with and keep it to themselves and find it very, very difficult to open up and talk about what they're doing or what they're going through. Yet they are struggling. They're struggling to pay the bills. They're struggling to keep their families functioning. They're struggling to keep themselves okay mentally because they are human beings. And for me, any man who comes up and says, I need help, is the strongest man. Not the ones who believe that I need to man up. Mental health, Gladys, is not about manning up. Mental health, it can be me, it can be anyone. It's not about that you are weak. It's just that you're vulnerable because of what is happening in the society. And I would like to just encourage all of us, the more we allow the space for people to talk about their personal struggles, and the more we allow people to just come open and seek help, the easier it's going to be for this country to manage mental health issues, because then we'll have dealt with the stigma, and mental health will look like any other illness, because mental health is illness. Why don't we look at it that way when we are dealing with diabetes or with other chronic illnesses? And mental health is serious, and what they need first and foremost, they need unconditional acceptance. They need people who can listen to them. And mental health, like any other condition, need the family and the immediate family support, because there is the medical part of it in terms of treatment, there is the psychological part of it in terms of treatment, and then there is the support system. And the three, if the individual doesn't receive the three, then it becomes more difficult to even manage what they are dealing with. And that's where the family comes in, the colleagues come in, and that's where the friends come in. And it's very, very, very important to always have someone who is your treatment buddy, someone who walks with you, someone who reminds you, Margaret, have you had your medication? When it's your next appointment? And talking of which, mental health illnesses, they are treated by psychiatrists, not just any other doctor. And it's very, very, very important that people seek treatment with the right professionals.
And we'll get more to that in a moment. Now, while the country battles the COVID-19 pandemic, another silent epidemic has been on the rise. I'm talking about anxiety and depression. This has been on the rise, as NTV's Nayoma Sampao reports.
Months into the coronavirus pandemic, the country is on the verge of another health crisis, with daily doses of death, isolation, and fear generating widespread psychological trauma. The Ministry of Health warns that a historic wave of mental health problems is approaching.
1 in every 10 people suffer from a common mental disorder.
Depression and anxiety are the leading forms of mental illness in the country, followed by substance use disorders.
Alcohol abuse is most prevalent in the 18 to 29 age group.
Global statistics by the World Health Organization put Kenya among countries with the highest suicide rates. But a good number of people suffering mental health disorders do not seek treatment. And just as the initial outbreak of the novel coronavirus caught hospitals unprepared, the country's mental health system, the ministry fears, that was vastly underfunded, fragmented and difficult to access before the pandemic, is now even less prepared to handle this coming surge.
Amid all these challenges, the country's total bed capacity for mental health care is 1,600, of which 400 are in the private sector.
In December last year, the President directed the Ministry of Health to put together a task force to provide practical solutions to the country's mental health problems. The task force in its report now wants the government to establish a commission for mental health and happiness which will monitor the country's mental health cases and coordinate the delivery of mental health services.
People are so afraid and shy of indicating that they are human beings who suffer from, say, depression or schizophrenia or PTSD, that they would rather stay with their illnesses at home.
The ministry says it will construct a mega facility dedicated to mental health in addition to strengthening the existing 14 county hospitals with mental health units. Nayoma Sampao, NTV.
That is the reality again we're living in. It's good to be aware so that you can actually get the right intervention. And speaking of which, Charity Muturi, you not only are a member of the mental health task force put together by the government last year that actually presented that report, which is also being presented to the government this year, but you have lived experience with bipolar. How are you doing in this pandemic?
Thank you, Gladys. How I'm doing in this pandemic is actually great. I'm one of the people who have thrived through this season. However, as a leader in different mental health support groups, we've had challenges. Immediately COVID hit, the first thing we had was increase in symptoms, depression, anxiety, and so on. And so we increased our support groups from once in a month to twice in a month, and we were able to meet online. And at the same time, there was the issue of economic challenges. So we'd have issues with rent, medication, food, and so we were fundraising between ourselves because we tried to look for support outside and we didn't get it, and so we started fundraising within ourselves. So what we've done is provide psychological support to each other and also economic support for each other, which I think is very important in this season for families and for communities as well.
And when you talk about challenges with medication, is it because of the social economic impact or just access to these mental health facilities?
Both, because one, immediately COVID started, like the patients at Madari, we received messages that the hospital, you know, the follow-up clinics are closed. So the hospital was open, but majority of people coming through were new clients, who are very few, and for the majority of follow-up clinics, not. So we had people having challenges with economic challenges in accessing the drugs, but also I think there was a panic buying at the beginning. So you'd find sometimes chemists do not have a certain drug. And then at some point when India went on lockdown, we also had certain medicines not being available. So it is all. And then for medicines, we have first generation, which is usually available at the public facility, and second generation, which is mostly at the chemist. So we had challenges with both.
Okay, and you speak about this being really rife during the beginning of this pandemic when it first hit the country in March. Has it gotten better with time?
I think we have adapted better. I can't say it's gotten better, but people have been able to adopt better because in our support groups, by the third month, the crisis sort of started going down in terms of adjusting to the season. So I think it is that our resilience got better because of having psychological support, but that is only within our support groups. But majority of people did not have access. And while telecounseling has increased, we still do not have the culture change where majority of people are happy to talk to a stranger on phone and so on. So the answer is yes and no. In some ways, it has gotten more challenging, but in other ways, we've been able to be resilient and adapt to the circumstances.
All right, let's hear from Tugi. Now, Tugi, you have lived experience with clinical depression. How has this season been for you?
First of all, let me just say thank you for having me. This season has been challenging because usually for people with depression, or at least in my case, you need a distraction from the thoughts going on in your head. So in March, I was still in school and we had to stop going to class in person and go online, and that switch was very difficult. But once I completed my studies, I had to figure out all of these. There were other things I needed to do, so I started working on different projects. I was writing music, I was writing a lot of poetry, but it's still difficult to just sit and do nothing in the house. So I had to find ways to to occupy myself, like Ms. Muturi just said earlier, the access to medication and seeing my psychiatrist, that was interrupted, and that was quite challenging for me. But there are other things. I was journaling, I was making things, making crafts, and so I've really had a chance to explore other avenues of dealing with my depression other than going for therapy and taking medication, even though those are absolutely important.
Okay, yeah. And if you were to pinpoint in retrospect, during the lockdown period and subsequent opening of the same, which were the most difficult moments for you?
I think when nobody knew what Corona was and how it was going to affect us. So you would hear rumors, or the country is going to be locked down, or the virus is spreading, and there's just this constant fear of, will I get it? Suddenly I am carrying masks and sanitizers, and I really hated going outside and seeing everybody in a mask. And I'm like, where are the faces? Where are the smiles? You can't see those things inside a mask, when people are wearing masks rather. So I think for me the most difficult point was just the uncertainty of the future. How long will we be in lockdown? Are people going to lose jobs? My friends would be telling me about their challenges, and I just felt very helpless. I'm watching my parents also make decisions about how they're going to go to work. My grandparents, like, just the whole, everyone was in danger, and we were not sure how we're going to make it through. But I guess human beings adjust, and it hasn't been as bad as I feared it would be.
Okay, interesting. And Margaret, it's obvious that uncertainty and, of course, severe changes in very many aspects of life have pushed many people to face mental illness, but also for those that have been living with mental illness, exacerbate the situation. So how do you now keep the balance, knowing that this is a new normal and you still have to live your reality?
For anyone, Gladys, whether you have a lived experience with mental illness or not, just that state of apprehension, I don't have a sense of control over what's happening right now, because what this situation has done is taken away our sense of knowing that this is how I'm planning my tomorrow, this is how my next week is going to look like. And just this state of a cloud hovering over your head, and also knowing, I don't know whether how susceptible I am to COVID, and just this state of everyone is on the edge just makes things very, very, very difficult. The other thing is the fact that we are still talking about the social, physical, we're talking about physical distancing and the lack of support. Again, that just makes it worse, like she has shared. How do we manage this very difficult situation? Number one, and this is what I'm telling myself and telling people around me, is that the primary goal for 2020 is not how much money you make. It's not whether you're going to graduate or not. It's not whether your financial goals will be met. It's not everything that we had set on 1st of January. The primary goal for 2020 is to stay alive and to stay healthy and to stay sane. If you're lucky to accomplish everything else, you're one of the very, very, very lucky people in 2020 to also achieve something else. When we are in this kind of situation, number one thing is to revise whatever goals, strategies, vision, and everything that you had to fit in the circumstance. So that then you're not beating yourself too hard that I had said I'll do this, but the circumstance we are in does not allow us or does not support us to achieve those goals. So we need to step down and lower our expectations. That's number one. Number two, we need to accept the situation that we are in. I would want to do so much, but I cannot do it because the limitations are way beyond my control. And that's very important. It may sound easier said than done, but we need to get to that place of this is where we are at. So how do I cope with the situation and the circumstance? Number three, it's very, very important because even during the darkest hour, there's still a glimmer of hope and light or something else. It's important to also take stock and ask yourself, what has worked for me this year? Because there's still something that has worked for you. Is it that you've really done well in terms of your infection prevention? Is it that you have done very well in terms of, managing your financial cuts and budgets and everything else? Is it the fact that even this year, as hard as it is, I still have achieved one or two things? Whatever it is that has worked for you this year is something this season to celebrate. Because then that just demonstrates you were able to turn things around and you had something going. And as we lower and step down our expectations, let's up what have you done that has worked for you, that has worked for your family. And finally, to just appreciate that it's not what was there in 2019 December. This is 2020 December, a different year. What can you do? So can we also be grateful? Every day write down what has worked for me today. What have I managed to accomplish? It doesn't matter how little or insignificant it appears, it's an accomplishment in 2020.
All right, the simple things in life will actually go a long way in helping you balance it all out, because we literally are all trying to ensure, as Margaret is saying, to see the end of this year healthy, sane, is the most important bit of this whole conversation. And speaking of which, we had asked you on the question of the day, do you know someone or are you living with any form of mental illness, depression, anxiety, bipolar, etc.? Have you disclosed it to anyone? And if not, why? That hashtag is new normal. Gibson Waishare says the stigma surrounding depression is way overboard, especially in an African setup where the male gender is always told to man up, and as a result, many hide what is ailing them, not knowing depression is a curable disease. Well said, Gibson. Lucy Kim says, yes, I have anxiety and depression to a point. I find myself talking to myself. It feels good though. Well, there is a point of wellness that comes out of that. And Margaret will talk more about that. John Mutai says, as for me, I have been living with mental illness, but my day is coming and all will be well. Amen to that, John. Josephine Rinya says, I was diagnosed with bipolar disorder back in 2009 while in Form 2. It made me to drop out of school and get medication. My journey has been tough, but God has helped me. Yes, I was stigmatized both at school level and in the community. However, there are great people who have walked the journey with me, including psychiatrists, counselors, my family and friends, and medical experts. Josephine, we celebrate you. Faith Kemi says, yes, my mom has depression. Thank you for sharing, Faith. Eduji says depression and joblessness is becoming the new normal to me, yet my government is politicking. Father, forgive them. Eduji, we hear your frustration. Nicholas Musumbi says lack of finances is the greatest of all causes of depression. We hear you, Nicholas. Jeff Ocheng says, I was diagnosed with psychosis and severe depression in 2017. I spent a month in Madare Mental Hospital. There is a lot of stigma. I know many people who took their lives. I chose to move out of Nairobi because of the shame of mental illness and start afresh somewhere else. Very, very sad. Really sad. It shouldn't be that way. Masi Kurgat says, yes, I have bipolar and I had to find myself and peace with what I was going through before I could come out. Mercy, we celebrate you. Ray Mambo says, I'm here. Myself, I think I have all of them, and I'm sure I'm not the only one like this. I never talk to anyone. Neither am I going to talk to anyone about it. What are they going to say about me? I just don't know, but I want to live my life normally as a normal person. And Buddy Krabby says, I'm intending to hurt myself soon. Oh my word, this is a cry for help. Let's make a note of that. And please reach out to somebody who can help you out. And those who can help, please reach out to us so that we can help out. We can help him out. Kevin Destiny says, I once told my friend that I'm really depressed, or I once told my friend that I was really depressed. You know what he told me? Wewe ni stress ya pesa ndio inakusumbua, depression ya watu wameomoka. Really? But this is the reality. Most people actually think that way. Dalmayari says, really, I'm living with someone who is suffering with mental illness, especially schizophrenia, and it's really a problem. So if you know a medical expert who can treat this mental illness, let me know. Dalma, there are many of them, and I'm glad you've reached out because we shall let you know of a few professionals you can be able to see. And Calvin, you are the founder of Let's Talk Men's Mental Health, and I'm sure some of that feedback we are reading out today resonates so much with some of the experiences you've come across. Talk more about that.
The reason why I even came up with Men Let's Talk was because having conversation with other men and that inclusive of my dad, and hearing how hard it is, but they don't have a place to share and talk. Okay, so I decided to come up with this forum for men where we can just meet and talk about everything that happens to a man, everything that men are going through, and see how we can help. And one of the best things that ever happened is ever since we started this, because I started with doing push-ups. We did push-ups, 20 push-ups a day. Okay, which it came up to about 600 push-ups, but then at the time we are done, and I found people rallying around and doing this, and I realized we are not alone. Then having a conversation with my dad is like, he's telling me things. I'm like, yeah, and I asked him, where do you share these things? He's like, I don't have a place. And I realized how many men are actually out there who don't have places to talk, who don't have, because the way that how things happen is the only place where men go to talk is when they're drinking. So they don't talk, you know, when you're high, you're not talking honestly, you're just talking because you're high on something. But a place where you can talk soberly and people will hear you, and you discover you are not alone, that there are actually people who are going through worse, and when we hold hands and come together, we can do much more. That when we hold hands and talk, you'll find someone saying, you know what, I know a friend or I know someone who can help you through this journey. And we've had the doctors coming in and saying, we are here to help. So let's do this together, which has been amazing to see. And so just to encourage the men out there that you're not alone, that there's something going on, and that you can join this and speak out and find a place where you can talk comfortably, not when you're high or doing other things, but you can talk and people will listen to you and not tell you that you know how people tell you that hizo si shida za watu wengine, ni shida za watu wengine. No, it's for everyone, people that are willing to listen and find a solution or help for you.
Okay, and Charity, interestingly, a lot of the feedback we just read out has people with lived experience with bipolar, and many of them not very sure of how to come out or who to even talk to, and some even stigmatized to a point of leaving town. From your experience, how long did it take you for you to disclose your illness?
That is an easy question, but without an easy answer, because I first knew about bipolar 10 years before I was diagnosed. And so there's a part of me that feels like that 10 years was part of denial. And honestly, even when I first said I have a mental health condition, I was suicidal at the time. So it wasn't even a conscious decision to come out. It is that I said it as part of a suicide plan, and then I survived and I couldn't take it back. And the thing is, we don't all have the capacity or the desire to be advocates. We have many people, even within our support groups, who've accepted their condition, but they are not willing to talk about it. Some because of the implication on their professions, and especially for teachers, because let me give them as one example, because sometimes their colleagues may embrace them, but the parents of the children may not embrace them. And so it's important to know where the problem is. Is it self-stigma, because that happens? Is it lack of acceptance, or is it that you have accepted but you're not willing to talk about it? Because we can't all talk about it. You know, there are repercussions sometimes. But what I would say is I always encourage people to see a psychologist. Because, and even for myself, I was sent to a psychiatrist by a psychologist. Entering a psychologist's office is pretty much like going for a HIV test. You know that your life can change at that door. And we have patients who, you know, wait, and then when they are almost next, they go to buy a newspaper and they don't come back, you know. So I say, number one, a psychologist can help you understand where the problem is. If you go early enough, you may not need to go to a psychiatrist. Not everyone who has mental health systems needs a psychiatrist. So encourage us to go to psychologists, be able to process your emotions, in the process prevent severity of symptoms, but in the event that you do need medical therapy, then they'll be able to assess and direct you there. So that is my encouragement. See a psychologist, ensure that they are a psychologist, because some counselors haven't studied mental health, or the courses do not include mental health, and sometimes it does more harm than good. So ensure that it is someone who is qualified. And you know, one of the recommendations we had as a task force is to have regulation of psychologists, so that we can know who is qualified for what.
Interesting perspective, and we'll touch more on those recommendations by the task force in a moment. Tugi, when you were diagnosed with clinical depression, did you feel the need to hide it?
No. First of all, I think there's something I need to clarify. Ms. Muturi has spoken about a psychiatrist and a psychologist, and to the kawaida mwananchi, those are the same thing. But a psychiatrist is a medical doctor who went to medical school, and then they specialize in mental health. So they are qualified and mandated to treat mental illness with medicines. So tablets, some people get something therapy. But psychologists are not medical doctors. They are trained, either they do counseling psychology or clinical psychology. They are mostly trained to talk, to use talk therapy, to use something called cognitive behavioral therapy, different therapies. And they don't necessarily just focus on emotions. I know some men are thinking, emotions. I don't have emotions. But basically, psychologists use many different techniques and theories to treat mental illnesses and other issues. It's not just mental illness. Okay, so now to your question. Did I feel like I needed to hide my diagnosis? No. I actually felt quite liberated once I got the diagnosis, because for a long time I had symptoms of depression, but I didn't want to say I was depressed, because my mother is a psychologist. So I felt like I had failed. How can I be the child of a psychologist and I'm the one who's sick? But I told her that, and she asked me, don't medical doctors have relatives and children who have illnesses. It's not a reflection of me. It's not my failure. It's not your failure. It's just a disease. It's just a sickness. So once I was diagnosed, you do tests. The psychologist doesn't look at you and say, well, naka depressed. They have to do tests. They have to have evidence, empirical evidence to show that you're actually sick in this way. So when the psychologist diagnosed me with depression, I felt so free because it meant that what I was feeling was actually real. I hadn't made it up in my head. I was not a reflection of my parents. It was just a few chemicals in my brain were not working properly. My moods were irregular. I was feeling very irritated. I couldn't control my emotions. And then when they said I have depression, I was like, oh, okay, this has a name. I'm not making it up. And for me, that was so freeing. I felt like I could actually now say, I'm not happy, or I'm feeling extremely sad, or I have insomnia, and that's because I have depression.
Okay.
Yeah.
All right. And Margaret, it's not everyone who has a Tugi's experience. Most people, just as Charity mentioned and Kelvin, would want to hide because they do not know how they'll be received. They don't want to deal with the stigma, or already have dealt with the stigma of the same. Talk about the importance of disclosure.
Thanks, Tugi. Thanks, Charity. Gladys, let's start with, even as we talk about the importance of disclosure, let's start with why does it take so long for someone to even get to the place of where things, people around you get to see, or why does it take so long for people to seek help? Number one, mental illnesses, because they don't cause pain physically. You know, when you have a headache and a backache and another ache, you know you can't live with that ache and you need to go and seek medical attention. The fact that people don't experience physical pain, that also explains why people take a long time to seek treatment, because mental illnesses, they are symptoms, and they are more of behavioral symptoms, and they are more of mental or psychological symptoms. They are observable by the people around them. And the fact that we also do not have all this information out there, what to look out for. Then it also takes the family member and the significant people in a person's life a while to notice that Margaret is not okay. And because me as Margaret, I also don't have this information, because we have a lot of information about malaria and many other things, but we don't have the true, correct information when you're talking about the symptoms to look out for in mental illness. That also delays access to treatment. And that basically means by the time the individual is going to seek treatment, they have moved from mild symptoms that would have been attended to and dealt with by the psychologist, and they're headed to severe symptoms level because of the cluster of symptoms. There are many now, and they're impacting a lot more heavier on the individual, and they will need medical intervention by the psychiatrist. So we can start by creating awareness about what to look out for. That's one. The other reason why people don't talk about it is because of the stigma surrounding mental illness. It's very common to hear that, you know, when someone is behaving different from everyone else, and people will have this talk of, you know, in every village or marketplace, there is a mad person kind of a thing. Schizophrenic is one among very many other mental illnesses, very, very, very many other. And what the common person is socialized to out there about mental illness is from a schizophrenic point. So when you talk about mental illness, the first thing that comes to people's mind is the symptoms or the behavior of a schizophrenic person. So that's where we are coming from. And we need to destigmatize mental illness, that it's not everyone who has mental illness who has psychotic symptoms, because depression doesn't have any of the psychotic symptoms. So people don't want to talk about it because of where generally we are coming from and people's understanding of what mental illness is. And then the other thing why people don't talk about it is because people begin to look at you as someone who is incapable of performing at work. So if I tell my colleagues that I am depressed or I have bipolar, and people don't even understand that bipolar has bipolar 1, has bipolar 2, and bipolar has different phases, the manic and the hypomanic. People don't understand those things. When you tell people about depression, they don't even understand. There are also milder, forms of depression. So when I say that I'm struggling with a mental illness, then people also, I'm afraid people will look at me as someone now who is not capable to be a good mother, who is not capable of being a good wife, who is not capable of functioning and working. If I am a student, then people will say that I cannot cope with studies. So then people, I don't want to talk about it because then I'll be fired, and then people will just put me in a corner of someone who is not useful, and someone who is not helpful, and someone who is not productive in any way. By the time you get to the place of significant impairment, it's because you've been with this mental illness and untreated for a long time. So it doesn't necessarily mean that you cannot be a productive mother, daughter, father, or anyone. You can still make meaningful contribution because you have the right support. And so people will not talk about it because of the way we make them feel and the perception we have towards them.
Okay, and the importance of disclosure actually has been answered by you breaking it down as to why people don't come out, because as Calvin was mentioning, when you do come out, the support system and also being referred to medical practitioners that can walk with you is very important. When we come back, we shall answer that one person who said they're in the verge of hurting themselves and give reference to where they can actually get help, because I'm sure he's speaking on behalf of very many people out there. Stay with us.
Malkia siku njema na tunukiwa offers kila siku.
Piga star 444 hasi utunukiwe credo double.
Christmas time, never had this much time to share good vibes, love and happiness. Christmas time, never had this much time to now. Oh, yeah. Christmas time, never had this much time to share good vibes, love and happiness. Christmas time, never had this much time to now. Oh, yeah.
Kuna moja nduzi, so I think miguu mbili nahitaji hapa na hapa.
I'm empowered girl from Korea.
But everybody was just do it.
I'm not sure of what the faces of those who will be going to Doha look like, but I'm certain they look like us. Mti inaweza geuka hivi na nikose kufika Nairobi.
Enjoy Christmas fantastic offers with Hisense. From smart Android TVs with Bluetooth and a warranty of 2 years to fridges and newly introduced chest freezers with a 5-year compressor warranty. Hurry to get one today till stocks last.
Welcome to Pishi Home Chef. Oh, just perfect.
We're gonna be cooking breakfast.
Making chicken shikaki, carbonara.
And I'm so happy to be on this show.
Most people think I can't do cooking. I forgot onions.
So I have to call her, literally to call her and ask her and pay your recipe.
Pishi Yoi.
Check out at Pishi254.
Oh yeah, ango ni Papa Jazz Papa bwana, nimejitwanga quarantine nikiwa na baby na watoto ndani ya kesi yake. Kitoko tu tunalamba unga hapa, tukirarua uji na mboka ninzike. Sasa shida ango ni kwamba last born rangu hamusambati. Hamelamba hand sanitizer yote bwana. Yote. Ati kwa sababu inakaa kama yogurt. Kwa kama ya findu vikhola without your knowledge. Na ni juice tu pia hamekula sapuni ati kwa sababu.
To get last born by audio motivation, dial *811*929#. Skiza.
Unapojijenga kibiashara na kuonyesha penzi lako, unga unaozaidisha uko papo hapo, kuzaidisha utamu wa maisha kwa kila namna, kila mara. Familia ya Ajab imeongezeka ili uzidishe mapishi. Mambo ni Ajab.
Hi, I am Eliud Kipchoge, World Marathon Record. I am here to encourage you to be active, to keep moving, and be positive in life.
Remember to continue using your Hafsa debit or credit card when out shopping to win fantastic rewards.
That's African acid. That's absent.
Sweetheart, when lori imekata break. Bra, when you gotta go with Neptune.
Thank you for staying with Your World. My name is Gladys Gachanja. This morning we are taking stock of our mental health in a pandemic. And of course, you do know this has been quite a tough year for many of us, and even tougher for those with lived experience with mental illness. And before we went to break, somebody actually reached out and said they are feeling like they would hurt themselves. And this is a cry for help. And I'm sure they represent so many people out there who are silent or do not even know where to turn to. And Charity, being part of this task force, and I know this has been at the heart of some of the changes you've been trying to enact through the task force, where can somebody like that get help?
Okay, one is, there's a hotline that was announced by CS Kagwe, which is by the Ministry of Health and Red Cross, and that is 1199. It's a toll-free number, so it doesn't cost you, and you can call even in the middle of the night. For someone looking for private private facilities, we have a lot of therapists and professionals online. For public facilities, we have Mathare, which has gotten 20 psychologists this year, and there is a plan to roll out to counties. So I would encourage you. And I'm saying this with all honesty. I have been to private facilities, county facility, mission, and so on, but I've never met staff like the ones that are at Mathare. People have a fear of Mathare, and probably because of the infrastructure or things like that, but the staff are fantastic. And I say this without being asked by anyone. And so even as I say the psychologists are there, all the staff you get at Mathare are very helpful. And so you can walk into Mathare, it's only 50 shillings to get a card, 200 shillings to register, which you'll only pay once, and then you can get access to a psychologist. And I have accessed psychologists at Mathare, and they're fantastic.
Okay. And Margaret, you were mentioning about the importance of level 5 hospitals too.
Yes, because Gladys, every level 5, you know, the provincial hospitals that are there, if you go to Nyeri, you know, Kisumu, there's always be a consulting psychiatrist who is posted there. Most of them also will have a clinical officer who is also maybe trained in psychiatry, and a psychiatrist nurse, because level 5s usually have a psychiatric unit. Yeah, so it's also possible to access there. And also to just tell people that even if you walked to any hospital, whether the doctor or the clinical officer you meet there, explain to them your symptoms and how they are feeling. They would and they should be in a position to give you an appropriate referral. Yes.
Okay, and Kelvin, there's something that has come up in this conversation. There are people who hear Mathare mental hospital and they say mimi huko sitaenda because of how people have viewed this mental institution for years on end. When we talk about access to treatment, access to intervention, some of the obstacles are actually the stigma around the mental institutions. What's your experience?
I think, let me start by this story. There's a time I was in a matatu and I saw this guy, he was seated at the back, and the guy just started crying. He was drunk, but he started crying. And you could tell something is going on with this person, but he doesn't know, or people don't know, and people started making fun and saying, "Oh, nafoende Mathare," and making it look like that place is only for people who have mental, not even mental, they're not okay. And the places are not there because they're there because we are not okay, and we need to accept that. But we shouldn't stigmatize them and say that they're for crazy people. Okay, because they're there to help and get us from a place that we're in, a pit that we're in, and get us to the next level. So we need to stop that for saying that it's a place where only crazy people are going to, because these crazy people need help. They're going through something. They're sick. It's not even being crazy. They're sick and they need help. So when you do that, you're making them feel like if they go to that place, they'll be the crazy ones. Okay, because there's a time I was told I need to go to that place. Someone made fun and said, watanipeleka ndo wapewe blanketi, or they'll be given blankets. You see, already that already shows that the reason why they're taking you there is to get something, but not for your sake, not for you to get help. Okay, yes. Okay, and for you, Tugi, what has been your experience when you think about accessing mental health intervention? I know your mother is a psychologist, so you have an upper hand in understanding these things. But people your age, what do you hear is a challenge?
I think there's fear. There's definitely fear. You don't want to accept that there's something wrong with you. But I liken mental illness to like having a cold. If I walked into my class, for example, and told my classmates, my head is paining, they won't look at me like, yeah, it's contagious, you're sick, do not come close to us. Mental health and mental illness is just, we should treat it just the way we treat medical illnesses, with the same enthusiasm to get treatment, with the same fervor. And so I just want to tell anyone who is suspecting that they might be mentally ill, you're not crazy, you're not mad. It's if you're a human being, you're most likely to have an issue with your mental health. You've gone through a lot of stress this year, wherever you are, whatever your profession, and there's help available for you. So do not feel like you're alone. Do not feel like your life is meaningless or worthless. It is not. There's a reason you're still here, and there's help available for you. You are not alone. You're not the first one to get depression, and you're not the last person to get depression or bipolar or schizophrenia. There are people who go to school and study for years on how to help you. So there's hope. Do not lose hope. Do not allow the stigma of our society to shut you down. You can overcome, and you will overcome. All you need to do is reach out for help.
Okay, and Charity, again, you said you had a lot of support groups. What is the impact of stigma in as far as mental illness is concerned?
Like I'd mentioned before, we have an issue of self-stigma, and usually we don't even realize that we are stigmatizing ourselves, and it's very impactful on confidence or even being able to get help. And I would encourage everyone, even if you're not at the place where you want to do advocacy, join a support group, because even as our families are very supportive, having a support group of people who understand exactly what you're going through helps, because there may be limitations in what you're able to tell your family, but there's the need for family, there's the need for persons who understand exactly what you're going through, and it becomes easier to move away from stigma when you're dealing with other people, because when people around you are talking about their experiences, it helps you rise up from stigma. The other thing is advocacy. You had talked about being disclosure, and disclosure can be on one-on-one basis or nationally. And I would say, as much as my disclosure came as a mistake, or so I thought, being out there has opened a lot of opportunities. Like during this COVID season, we've had 30 media engagements by people with mental health conditions, different ones. Beyond that, we've also come together with others who have non-communicable diseases, because mental health falls under non-communicable diseases even at the Ministry of Health. And so we've been able to advocate for, to get passage in the barriers where we've had people who have letters from the psychiatrist, they have letters from the chief, and they're not allowed to go. And we've been able to actually sit with the Ministry of Health NCD department every Monday at noon. And so that advocacy actually helps, because, I mean, like for me, I had a drug that I was given by KEMSA through Madari that affected my kidney in 3 months. And I may not be able to change that for myself, but I can be able to change it for others. And so what I'd say is it has really helped, because if it's not the barriers, we've been able to talk to KEMSA through the Ministry of Health NCD committee to talk about the challenges that we are having with medication. We've been able to get NHIF on the table and tell them this 500 is bringing a problem, and now we have what you call them, penalties, huge penalties, and that has led to NHIF giving us amnesty, where regardless of your penalties, you can pay 1,500 and be able to access services. So I would say, as part of growth, there's that point where you need to understand what is going on and accept it for yourself. But we do get to that point where part of healing is reaching out to other people and making it better for them. Because my desire is for those who are being diagnosed today to find better systems than I have had myself. And that has led to even having opportunities to push for inclusion. Without advocacy, we would not have gotten a seat at the Task Force on Mental Health. Since then, we've gotten a seat at the National Suicide Prevention Strategy Committee. We've gotten a seat at Madari Hospital at the board, which just happened, I think, 2 or 3 weeks ago. We've been able to get a seat at Kamili Mental Health Care, which is a community-based service, and we have representation in the board. Last week, we spent 3 days with WHO, with 40 patients across different countries, to say that our experience, even that one of KEMSA, just going to a lab and sitting and waiting for results is experience. Getting to know that my kidney has a problem because of this drug is experience. And what I say is, one hand cannot clap. So the doctors and professionals are one hand. We as patients are the other hand, and we can do a good job together. And so having inclusion and pushing so that at some point we would be able to have representation of someone with an uncommunicable disease and a communicable disease at the clinic, at the dispensary, at the National Parliamentary Health Committee or in the county health boards. At WHO, you are challenging them. We want a seat there. We want a seat at the UN. We want a seat at the African Union, because we have value that we can add. But it takes that step to understand yourself, be comfortable with yourself, and then talk about it.
Okay.
Talk about it and then coming together, because we've been able to accomplish a lot more together when we've come together as persons with mental health conditions, together with persons with cancer, kidney, diabetes, and we advocate together.
Very well said. And the board that she talks about, the Mathare Mental Hospital Health Board, is now in place as the government takes the first step in fulfilling its pledge of giving priority to the long-ignored mental wellness of its citizens. In his State of the Nation address in November, if you remember, the president pledged an upscaling of measures to improve mental health. And according to the Ministry of Health, mental health cases have spiraled in the last few months owing to job losses, huge losses in business, and even lack of freedom of association in a bid to curb the spread of COVID-19.
For many years, we have let down those of our society members who are mentally challenged, all the way from being hidden in homes, mistreated in institutions, ignored by society, stigmatized in a manner that is not befitting of human treatment. And therefore today we want to start the journey to remove that stigma. The vision is to establish a regional mental research, teaching and referral hospital. And I would like to disclose that ultimately this hospital will be located in our 200-acre land in Karen.
Strides are being made in the right direction, and the mental health task force that was put together by the government has spearheaded a lot of that, just as Charity is mentioning. And Margaret, even as we take stock of our mental health, it is important to be aware of coping mechanisms, which come in two, good and bad ones. Talk about.
Let's start with the bad and end with the good.
Yes.
The bad is the obvious one: substance use, alcohol, drugs, and everything else. And one of the things about why people resort to substance use is when you're trying to numb your emotional and psychological pain. So, because some conditions like depression really take you down. They depress, that's it. So people look for something that's going to give you a bit of energy and lift your mood a bit. And that's how people end up in substance use. Now, the thing is, now they become comorbids. So you have a substance use disorder and then you have a depression. So substance use is not a positive coping mechanisms. The other thing, and it's the gentleman also talked about, is the issue that you see a lot of the self-harm. And you know, the cutting, the lacerations and the mutilation. Again, that when you see someone doing that, it's because they're also trying to deal with their psychological pain and the emotional pain. And it just tends to give them just a bit of relief, and they shift from the psychological pain to that physical pain, and that just gets them away for a minute or for a few seconds or so. But the thing is, you haven't dealt and resolved with what pushed you to that. So when you do that, it doesn't take you away and it doesn't get you better. We still have the trigger, which is an underlying thing, and it will keep wanting to pop up and pop up. When we talk about positive, number one, Gladys, is sleep. Sleep is everything, and good sleep at that. There's nothing cool, and let me say it here, there's nothing cool whatsoever about the people who take stock of usiku sako. There's totally nothing cool about that. You need sleep. You need quality sleep. You need to sleep the right amount of time. We talk about time, we talk about quality, and we talk about quantity of sleep. And one of the things that is a big problem with people in sleep is the use of the gadgets. phones, laptops, iPads, everything, watching late night movies and everything, they are triggers to poor quality sleep. So what do we need to do? Put your gadgets 30, 40 minutes, 1 hour before you sleep. Sleep at the same time, wake up at the same time. Then the other thing is physical exercises. And I like what Kevin said, the gentleman, about the push-ups. When we exercise physically, we bring out the pent-up emotions. We inject a lot of oxygen into our system, and exercise is a mood lifter. So one of the things we also use to manage depression is physical exercises. Get out, get sunshine, get fresh air, walk. We can do all these things at home. The other thing is the social network. We all need someone to talk to. And this is very important. This season, put it in your list of things to do. The people you have not talked to in the last 2 months, the list of things you must do that day is call someone. And when you call, ask, Gladys, how are you doing? The answer will be, I'm fine. Then ask them the second time, Gladys, how are you really doing? Just call someone, talk to them, offer to be there. We all need someone who reaches out to us and shows that I care about you. And the final thing I would like to say, Gladys, is you will never deal with it if you don't know what you're dealing with, what you're struggling with. So for me, name it to tame it.
Aha, well said. Name it to tame it. Very well said. And even as I take the last final remarks from those with a lived experience, I'll start off with the gentleman. Kelvin, you've walked down this road. Now you hold other men as they walk in the same shoes. Your parting shot?
Find community. Community is very important. And accept yourself as you are, and accept when you're struggling. Don't fight it, because that's when you fight it, then things get chaotic. But when you accept, then you're able to get help as fast as possible.
And still speaking about the men, the importance of a support system, please reiterate this.
When I say support system, is find people who are willing to listen, are willing to be there, and will always create time when you call them. And when you say I need help, they'll show up, even if it's even if it's late. How late, they don't care. They'll be at your doorstep to say we are here. Because I have friends who I call them at midnight, they'll come home and say, what do you need? So that's, I think, when I think of a support system, is having people around you who will hold you accountable and who will ask you the hard questions of those that men don't like. How are you doing? How are you really doing? Okay, so that's when I think about support system, that's how it should be.
And Tugi, for you?
First of all, I just want to say thank you so much. This is my first time on TV talking about mental health. So thank you. I want to say that it is possible to live with mental illnesses. It's possible to live a functional, fulfilling, wholesome life. And your life has meaning and purpose. So whatever challenges you're going through right now, you can overcome them. They don't have to defeat you. You can overcome them. You can push through, and there's help available for you.
Yeah, there's life beyond a diagnosis. Thank you, Tugi. And Charity, you've walked this road a long time, and now because of your experience, you're giving opportunities and opening spaces for others. Your final remarks?
I'm happy to hear, the other panelists talking a lot about support, because we need to come together as families, we need to come together as communities so that we can get through this season together. And let us support the people with mental health issues around us. For our national government, I challenge us to put aside mental health financing, which, as recommended by WHO, is 250 shillings per person per country per year, but for our counties as well, because we will never be able to achieve health equity through the national government alone. So I want to challenge our counties, put aside 250 shillings per person per county per year, not for mental health conditions, for mental health. so that we can focus on prevention. I'd like to celebrate our health workers. You've really supported us in this season. And Madari people told me to say habari. Inclusion. We want a seat at the table, not a short-term one, not a suggestion box. We want a long-term seat at the table because we believe there is nothing for us without us. The focus right now is on community-based care. According to WHO, the first level of care is self-care, and then informal community care, where we need our pastors, our teachers, our traditional healers to learn the symptoms of mental health conditions and then refer to community-based services, because we are moving away from long-term facilities to community facilities with a focus on outpatient. It is only after that that we can look at now the general hospitals that have been mentioned or the long-stay psychiatric facility. So let us promote self-care, let us promote community-based mental health services, and nothing for us without us. Thank you.
Very well said. Charity Muturi, she's a member of the Mental Health Task Force put together by the government last year to look at the state of mental wellness in this country. And she also has lived experience with bipolar. That's why she is so passionate about speaking of the same. We were also joined by Kelvin Odek, who is a founder of Let's Talk Men's Mental Health. Thank you for your time. To Gi Wayaki, who has lived experience with clinical depression. And as you've heard, she also is an adequate mental health advocate, and of course Margaret Mbuthi, who is a clinical psychologist. Thank you all for joining us on this conversation and being candid on your own journey with mental health. Now we take a short break, but when we return, we'll continue sampling some of your feedback, even as we understand your journey with mental illness, and if you have disclosed the same, and if not, why, as we also engage somebody who is actually looking into spiritual leadership and the importance of the same, but she's also a counselor, so she'll also give us her own uptake of today's topic. Stay with us.
Premium candles. It is made of pure, fully refined paraffin wax. It doesn't have smoke. It has long burning hours. It is non-drip. It doesn't smell.
Always smile and work with Sumo Candle from Rock Industries Limited. For inquiries, visit our offices at Ndume Road off Lungalunga Road behind Carton Manufacturers near Sinai Stage. You can also talk to us through 0722 575 619.
Did you know at Ruiru Mabati Factory you can open an account and lipa pole pole at your convenience? Did you know at Ruiru Mabati Factory you can get customized sizes according to your roof plan to avoid wastage? Did you know Ruiru Mabati Factory offers free delivery countrywide within 72 hours?
To order, call us now. 0111 050 700. Ruiru Mabati Factory, mali safi kwa bei poa.
This Christmas, jaza kwa sababu there's a whooping 1 million bob to be won. All you have to do ni kupiga shopping worth 1,500 and above. Now kontani ya draw. Krisi, ibambe na Quickmart. Quickmart, fresh and easy.
To achieve great things in life, you must do little things every day, like the 1, 2, 3 with Colgate.
1, wake up. 2, brush up. 3, smile through your day with a fresh breath and strong tea. Smile through your day with a fresh breath and strong tea.
Do the 1, 2, 3 with Colgate and give yourself a future to smile about.
Rock Industries Limited wanakuletea bidhaa za plastiki zinazotumika kila siku maishani, kuanzia matumizi ya jikoni, usafi na shuleni, miongoni mwa matumizi mengine. Chakula kitamu sio upishi tu, kikiwa kitamu kisha kipakuliwe katika vyombo maridadi kinakuwa tamu zaidi. Ndio maana Rock Industries Limited wanahakikisha mezani na jikoni kunapendeza kwa kukuletea vyombo maridadi vya plastiki. Vyombo hivi ni vya viwango vya juu, vyenye rangi nzuri ya kupendeza, umbo wa kuvutia na vinadumu. Baadhi ya bidhaa za plastiki kutoka Rock Industries Limited ni vikombe, glasi, sahani, jagi, begi, bakuli, vijiko, vichana na kadhalika. Bidhaa hizi muhimu zinapatikana katika duka lililo karibu nawe pamoja na maduka ya jumla kwa bei nafuu. Kwa maelezo zaidi, wasiliana na Rock Industries Limited kupitia nambari 0722575619 au 0736028181.
Ban Jikoko wameamua kujoin dance ya chini kwa chini kibei, yani jiko zao sote wameamua kupunguza bei, chini kwa chini, 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 chini kwa chini.
Okoa Krisi na Ban Jikokoa. Ban Jikokoa, jiko asili ya Kenya.
We are Nation, Africa's independent media brand. We are committed to empowering all Africans, from the young to the old, from the curious to the educated, and from the heart of the cities to the rural areas. We are Nation. Join us, because if you want to get far, you do it together. Nation. Empower Africa.
Sweetheart, kwani lori imekata break? Bra, when you gotta go with Neptune.
Thank you for staying with Your World. My name is Gladys Gachanja. As you know, today we've been taking stock of our mental health. And our question of the day to you is, do you live with any mental illness? Do you know somebody who does? Have you disclosed the same to somebody? And if not, why? Talk to us. That hashtag is a new normal. And you're still talking to us. Samuel Ngoge says, it's not easy to disclose this to people. These days, most of the people, mostly who you call friends, are happy when seeing your downfall. It's unfortunate, but a reality. Atunga Hazard says, depression is a norm for many Kenyans who have been hit by the high cost of living and poverty. I included, where sometimes you think to an extent you become blank. Atunga, we hear you. Victor Adero says, I think I'm a victim. Unfortunately, I haven't disclosed because I don't have no one to do so. Victor, we hear you, but you can always reach out to a trusted friend. And we have Ahmed, who says, I know somebody, but I haven't disclosed. Or I know a victim, but haven't disclosed. Well, many people feel shy about disclosing their mental state. And it is interesting because stigma is still rife in society, and this is one of the reasons why most people will not talk about their mental state. And even as we understand this better and shift focus on our conversation, this other conversation about spiritual leadership, Reverend Canon Dr. Rosemary Mbogo, who is a Provincial Secretary, Anglican Church of Kenya, and also an author, joins us. And I'll start off with the fact that we are in a pandemic, and apart from you having all these hats that you wear, you're a human being. So, Reverend, how are you doing?
Thank you, Gladys. I am doing well, by the grace of God, because the moment has been stressing, training, and with a lot of people, tasks to handle, and diversity of all nature, with the nature of what I do, but also with the community involvement and a broader national, placement that causes me to be broad in touching people's lives, and generally that impacts on you as a person. So I'm well, but you definitely get distressed at moments.
Okay, and
Yes.
even as you hear from our feedback, we have so many people struggling with their mental wellness. From your experience, what have you seen and how are you helping them cope?
Basically, it is very true that people are distressed, and some of them are depressed. I've gone to that level because there's job losses. There is also cut down on salaries, and there is business opportunities that have been lost, and obviously with needs that have not been cut down. And so demands are there, and living standards are being affected. And what we are doing as church and as a person of faith is basically to reach to the communities within our places of worship, as well as visitations into the communities where they live.
Yes. And they say mental health or mental illness is the unseen pandemic, and you are a leader in different spheres. What is the role of leaders in helping their flock, so to speak, in maneuvering through such times?
A leader is a human person, but living among humans, and yet connected with the mind of God and that which is the divine will of God. So they have a bigger assignment and responsibility, not because they are superhuman, but because they depend on a power that is above them. And that makes them be responsible to reach out to all facets of humans that the Lord God Almighty puts a responsibility over them with the grace that God himself gives. And that is the responsibility of every leader, that every leader needs to realize that you have cohorts of groups that you are responsible to reach out into. And so creating time and opportunity to reach out to every one of those cohorts across the intergenerational ministry, because ministry is intergenerational, life is intergenerational. So the key thing is that one must look at society and the communities that we minister to in the place of faith, as well as where these people live, as intergenerational basis, so that we are able to speak to them.
And we are talking about living in a pandemic, and people have different experiences, with most of them being challenges. But then again, there's been a silver lining to this pandemic. And speaking of which, Rosemary has had a silver lining in the form of this book, which is titled What Sustains a Spiritual Leader, a book that you wrote during this pandemic. Talk about that.
Yes, I am really very grateful, Gladys, that when we got to lockdown, and indeed it was lockdown for everyone, I felt charged within me to put down into writing that which concerns leaders across all circumstances of life, and more specifically spiritual leaders. And what I felt charged regarding was that leaders who are spiritually called of God do not necessarily utilize the space in the worship center, because, for instance, even the worship places were closed down. And so the key thing is, how do you minister to the people where they are now? They are in their households, where they live. They are spending time with their families, and some of them are totally on their individual selves. But these people also operate in other spaces of life. They are professionals, they are in the government sphere of service, and they are spiritual beings. They are in the private sector, running businesses, which many of them had been closed down as well. And so we found it's just some threads or strains of the government personnel that were fully operational in beginning to speak to the citizenry of Kenya on the direction of how to behave, particularly the Ministry of Health, the Ministry of Interior, in coordinating people and helping people to behave and remain where they have been told to remain. And yet, these people have their minds, they have their physical being, and they have their hearts, and all of them require to be ministered to. And so as I thought through that and I went and walked through it myself, I felt the change to actually get seriously to put down the calling of a spiritual leader in whatever facet of life where they are put in by God to serve his humanity, and how the individual leader himself or herself ought to conduct themselves, and then the responsibility that is laid on them within the space that they are given and the opportunities that are in their hands and the time, because time is of essence for every leader and for every placement that is given to us in life. And so that is what basically I felt church to do. And in the speaking into this book, it touches the person of the leader, called by the divine power of God, and the need to have that clarity of self. And then after you've had that clarity with self, not only at the calling moment, but consistently through the time that you are carrying out your duties. Because if you don't check yourself with the caller, then you, the cord, you lose the pace. And you also lose focus. But when you are consistently aligned with the caller, you, the cord, carries the message that the caller desires of you. And that is God. And then how do you then make sure you remain balanced? Because, again, as I said earlier, you're ministering to different cohorts of people. Even if you're in the private sector, as a spiritual leader, you have the young, you have the middle, the adults, the senior citizens. They all need to be handled differently. And you have a responsibility, and you need to give time to them and attention. If you're in the government, you need to realize that space has a responsibility, it's an obligation that calls you to align yourself as a spiritual being with the lives of those that you serve, and not ignore or exclude anyone in the services that you render. And more heavily for that, the one who is a spiritual leader within the place of faith, then you have to divine the word clearly, so that when the people listen to you, they have the message to carry them to the operational base where God puts them.
Okay, and you have served as a member recently of the government-appointed Interfaith Council on the national response to the coronavirus pandemic. How have you used these resources you speak of in this sphere of influence?
Thank you, Gladys. That was very, very timely. More specifically, because this was a council that got on her duty when everybody else was sort of frustrated and wondering. Basically, the key question kept being, where are the people of faith? Where are the leaders? Where are our spiritual leaders? Where is the church? That was a constant, voice that we had in the air, because people were wondering who is speaking to us, who is speaking for us, who is concerned about us. And so as we sat together as the Interfaith Council and cutting across all bodies of faith in the nation, we were able to think about that entirety of the populace in the geographical terrain of Kenya. And we were also able to compare base with the others within the group and what is going on in their world. And we're able to dialogue, discuss, and discuss what needs to be done and how does it need to be done, when does it need to be done, and what are the key measures that are required to be carried along. And so we came up with the protocols that were needful for people getting back to places of worship. And we did not just sit and prepare the protocols. We kept on speaking to the nation through press statements that were constant, so that we were aligning ourselves also with the national leadership, His Excellency the President, so that we were part of the process as he spoke to the nation on phased reopening, not only of the places of work that had been locked down, but places of worship, and generally getting back to business. And then we got ourselves into every county. And every individual member was handling 3 counties as an individual. And into the counties, we got into the leaderships of the counties, the governors, and the county commissioners, and the other line of leadership with the Ministry of Health, and shared the protocols with them and also got to initiate interfaith committees in the counties, and we have worked concurrently with them to the present, consistently checking up on each other and asking, how are you ministering to the people? How are you ensuring that protocols within the places of worship are adhered to? And we are thankful that the places of worship have actually adhered to protocols. And we have not had incidents at all that have been nasty in the places of worship, which means really basically in relationship to what the book speaks into, the spiritual leaders are influencers. You are pace setters, and your word matters as well as your acts. So there has to be an agreement between what you speak and what you do, because people are watching. Sometimes even without you saying your word, whatever you operate in the base of operation means so much to the people who are watching.
Now, as a country, apart from facing the pandemic like the rest of the world, we also have other business going on, especially in the political scene. And this is where the ethics and the priorities of the leaders come to question. From your experience, at a time like this, what should leaders put in place as a priority?
The lives of the people matter most, because God, our almighty creator, of whom as a nation we give allegiance to, that God is our sovereign, leader and authority of this land. The leaders ought to bear the lives of people as a key priority. And this is not done in abstract or in absence of organs and institutions, because it is within organization structures of the nation and the networks that we have in the in the entirety of leading of the people that matter most. That is where processes are carried through for services to the people. So, and in every one of these institutions and organizations and structures of leadership within the country, we have people who have been given positions. Those individuals have a calling, not just to get themselves lost in the masses and in the crowd and speak like they are not accountable. They must speak like persons who are going to be held accountable by the citizenry, but more importantly by God. And so when leaders mishandle the space that is in their hands, it is really a disservice, first and foremost to God, then to themselves as individuals, because they don't live in isolation. They live with the rest of the humanity, but to the common mwananchi. It's so important that the leader, constantly remembers, I have made a commitment, I have an oath, and I am responsible, but I'm going to be held accountable. Sometimes it's frustrating when leaders, and many of them, actually, majority of them, if not all of them, align themselves with faith, with some place of spiritual worship. They are accountable for that commitment to be dignified in their conduct and character. A conduct and character that does not disagree with the behavior and the acts that they undertake in the society. So we hold them accountable as a people, and I take it personally as a responsibility. So though I may not be a political leader, and I am a spiritual leader, I also have some space to speak into that particular cohort of people, because they will come into places of worship, but also I am privileged sometimes within the leadership positions that I carry to endear a voice towards them and to them and be able to speak to them. So I do it sometimes at a personal level and other times at a collective level.
Okay, now let's talk about some of your accomplishments. And you are the immediate former chairperson of the National Council of Churches of Kenya, NCCK, where you made history as being the first woman chairperson of the council since its founding, and the first female canon Anglican province in Kenya. I mean, these are just a few of the first that you've been able to do in your professional life. What is the role of women, even as we talk about spiritual leadership?
Women, like men, are God's creation. And when God created man, male and female, He created them, and he did give them a command and an assignment to take responsibility in having dominion over his creation. That means both the male and the female have a responsibility. The women must take up their space and not allow themselves to be excluded from the space of leadership, as well as from the space of impartation, that influence of generations, because it is never a competition when male and female are given space or look for space to serve humanity. It is complementary assignment, and where women fail and their voices are not heard or they are excluded, it's a total disservice to the humanity of God, because there is a design in which God has created the woman that is very different from that of a man. And the voice and the citing, the detaling of a woman, if absent in any cohort of leadership or space of a community, that space, that community lacks heavily. And I think for me, the way I address leadership for women and men is that men need not be threatened at all by women taking their positions, and the women should not apologize for the gifts God has given them, because it's divine. It's not something you borrow out of the way. It is inbuilt in us, and God cannot give gifts and then expects us to just not utilize them. So the woman has her place.
Okay. Yeah. And even as we bring this conversation to an end, I mean, they say to whom much is given, much is expected. So what is the importance of targeting and attaining excellence in all spheres of life when it comes to a leader?
Balance is of essence. Because if a leader does not take time to rethink and refocus, they will easily lose track. And the track loss could be either in the loss of their wholesome health, because they have not taken time to eat well, taken time to rest, taken time to reflect, and consistently ask, what is my purpose in life? For what reason do I have the space that is in my hands? Who am I accountable to? And to whom am I answerable for the things that I do? So the leader needs to balance themselves and consistently think about also being destiny helpers. You are not an aid to yourself. You must mentor others. You must enable others. Appreciate networking. Appreciate team play, because we work together and the excellency is attained as teams. A leader must consistently remember that indeed they need to leave behind them a legacy that will withstand the test of time. That after the end of my space and life, what do I leave behind? And building into posterity is critical. Not sometimes, but all the times. And then balance between hardships and trials with riches and provisions that come as trappings of power, of placement, of possession. Lest somebody quickly thinks, I have gotten it all, so now I can eat and drink and have my merry. We must balance, bear the pain with others, and also when it faces us, we realize it's part of life. That balance is of essence.
Very well said. Reverend Canon Dr. Rosemary Mbogo, who is a provincial secretary at the Anglican Church of Kenya. She's also an author and she wears very many hats. And she has recently written this book, What Sustains a Spiritual Leader, which will be launched on in January?
January 13th.
Yes.
At All Saints Cathedral. And you are welcome, 4:30. Yeah. We are inviting all leaders from the government, positioning, within the academia, within private sector, within the church, or places of leadership. This is your space. Come, we share together and be able to serve the humanity of God better.
Thank you and congratulations, Reverend, on this third book. And as you heard, there is a lot that goes into it and a lot has been brought out. Remember, to whom much is given, much is expected. So this is definitely a must-have book for any leader. Well, thank you for joining us on Your World this morning. Tomorrow we'll be back on Your World, looking at different facets of life. One of them will be on food safety and its relation to the environment. See you then.